One of the top surgeons in the U.S. is breaking ranks and refusing to perform gender surgeries on children. He says he's worried about the long-term effects and says there's not enough research to safely do these procedures. Dr. Stephen Williams is that surgeon, is the president of the American Society of Plastic Surgeons. And the good doctor joins us now. Sir, what kind of surgeries are we talking about here?
Sure. First of all, good morning. Thank you very much for having me on. We're talking about gender-affirming care for minors only. The American Society of Plastic Surgeons really feels there's not enough evidence out there to support these types of procedures in minors at this time, in adolescents.
So specifically, we're talking about surgeries like the top surgery, which removes the breast from a woman, things like that, correct?
Well, again, we're talking about adolescent care, and I think that's an important thing to differentiate. And so there's a host of different operations that can be considered as gender-affirming care, and they really involve a group of procedures that allow an individual to become more aligned with their gender identity.
Okay, so why? Why won't you perform these surgeries?
Yeah, so it's a great question. The real issue here is, as physicians, we're driven by evidence, and our care also involves compassion and interaction with patients. But, we have to really look to the evidence when we're thinking about what the appropriate care is for patients. And this is a newly developing field. And for, again, adolescents right now, the evidence, there's just not enough of it yet.
So is your concern that you don't know what the ramifications of a surgery today are going to be 30 years down the line? Is that basically your hypothesis here?
I think there are a lot of things to consider. One is safety of the procedure. These techniques are still in development. And again, this is a new field for adolescents. There is a lot of psychiatric and long-term results that we need to get better data on. And this is a particularly vulnerable population. And again, I think it's important to distinguish that we're talking about adolescent patients. For adults, this care is well established.
How difficult is it to reverse these surgeries if you perform one on an adolescent?
It depends on the procedure you're talking about. For top surgery, it's relatively easy to reverse. However, it does leave scars. Every surgery leaves scars that have to be dealt with. And that's the bulk of the procedures that are performed in adolescents in the United States at this time.
Biden officials reportedly pushed to remove age limits for trans surgeries. Congresswoman Lisa McClain is trying to get to the bottom of that. Why? Why do you think the Biden-Harris administration was so intent on pushing this so hard to remove these age limits?
I think the nice thing about being a physician is I try to pay more attention to the patients and what goes on for what's good for the health of America, and less attention to politics. But the discussions, I think, amongst the current administration were around international groups and, again, trying to get to the bottom of what's going on. This is a newly developing field, and it's important that we have research that backs up the procedures that we're talking about for patients that are interested in this.
Yeah, I think that's the key that you mentioned throughout this interview. It's so new. You have to do the research. You have to have studies that show. And this is such a brand new area. You don't want people rushing into things. And I think your reticence is important. Dr. Stephen Williams, thank you for your time this morning. Appreciate it.